IRS penalty was more affordable than actually buying insurance. While being able to remain on their parents' health care plans until age 26 helped, the relief was short-lived. After congressional leadership makes good on their promise to repeal and replace Obamacare, what role should the Commonwealth take in increasing access to affordable quality health care for all Virginians? We'll start with Mr. Riggleman.
Thank you. Being the last question based on this, I don't know if you guys know this, we actually tried to get into Obamacare as a business probably about a year ago. And the premiums were so ridiculous, we went over to a private holder. So I think what you're seeing as far as millennials, I think they saw the shell game that was being used to have higher rates for them to support people who maybe weren't as good as health, maybe like old people like me. So I think that's what was going on. As far as changing something, it's something we've been studying, but I wonder this. I wonder if Virginia can have some type of supplemental insurance that goes along with people to a certain age also. It would be hard to fund. I've seen some other trying to do it for veterans as far as funding it from the state level. But if we have a real policy and we study it, how can Virginia specifically, without federal interference, support millennials with their insurance issues? And how do we balance that out? I think that's a question. I think this is the toughest question of the entire forum that we have right now. How do we use Virginia and how do we use Virginia state funds responsibly to support any type of retroactive thing on ACA, which I never agreed with to begin with, but how do we make sure that works? I think that's something we have to look into. I don't have a specific answer for it. I'm pretty honest about it because we have tried this in the personal business level so many times to find cheaper insurance for our employees, and that's why we had tried the ACA and it failed miserably. So right now, when I'm looking out at this audience, looking at what we do with our own employees, at some point, how does Virginia support that type of insurance and that type of support for millennials? Thanks.
And Chairman Stewart.
Closing statement after this?
Yes, we will.
Okay.
This is just we're still in the question and answer.
All right. Very good. Thank you. Well, first of all, how many of you work? How many of you work? All right. How many of you are millennials? And how many of you are paying, because you're working, you're paying payroll taxes, including Medicare, Medicaid, and Social Security? And how many of you think that you're actually going to be able to benefit from those programs when you come of age? Not a single hand goes up. We are ripping off this generation right now. You are subsidizing what's going on now, and by the time you come of age and you're making lots of money, there's not going to be a lot left. And when you retire, there will be nothing left. We've got to take this on head on. And the only way we're going to be able to do this, and by the way, the Commonwealth of Virginia, in 1985, we were spending 5% of the state's budget on Medicaid. And today, that is 22%. We've got to control it if we want any money left for any other state program. The only way we're going to do that is to block grant Medicaid, work with the Trump administration, which I intend to do, and cap Medicaid spending at 20% of the state's budget and make sure we're leaving room for all the other states' programming, especially education and transportation.
Mr. Gillespie.
Obviously, this is heavily affected by federal policy, and I am looking forward to the Republican Congress and President Trump repealing and replacing the Affordable Care Act and giving us a chance, particularly when it comes to Medicaid, when they can block grant it to the states. Let us innovate. We'll be able to save money for our taxpayers, and we'll be much more innovative with those programs. But there are things we can do at the state level to make health care more affordable. And that includes, for example, allowing us to have insurance sold across state lines. When Governor Matt Bevin was in from Kentucky campaigning with me just recently in Lynchburg and the Valley, we talked about this. And the fact is, let the states innovate. Let us have our insurers compete in Kentucky. Let Kentucky insurers compete here. And that will be good for consumers. We need to allow for small businesses to risk pool so that they can get the benefit. Even small employers can get the benefit of group rates. And we also need to allow for reforms of our certificate of public need policies here in the Commonwealth and for direct provider insurance coverage for businesses as well. There's a number of reforms that would help us bring down the cost of health care. I want to touch real quickly with a little bit of time I have left on the previous question because I think it's a very important one. And one of the things we need to do for some of those rural communities and some of the communities that are struggling economically is get not just infrastructure in terms of roads and highways, but broadband and cell phone towers to create opportunities. And I see my friend Saul Fernandez here, And he is someone who is, is leading the charge in Southwest Virginia on this, and he and I are working together on some policies in these regards, and appreciate his leadership at the local level as a supervisor. We need more of it. So thank you.
Senator Whiteman.
Thank you. And as Nancy Pelosi says, you got to pass it to find out what's in it. And I think all of us experienced what was in the Affordable Care Act. It was the Unaffordable Care Act, and it's caused problems throughout, and quite frankly, I think led to the demise of the Democrat Party in its most previous election. We touched on a number of things, but some of the innovative programs we're looking at, we very, very much are looking forward to the opportunity to have that block grant Medicaid to the state. We know we can do it better in Virginia. We know we can do it with a lot less paperwork, and when you delve into the healthcare issues like I have for the past 20 years in the General Assembly, you will find out that a large amount of your healthcare dollar that you pay today goes to paperwork, goes to people that don't practice medicine at all, but check on other people, to check on the bills, to do those kinds of things. This is an opportunity. If Washington takes the shackles off of Virginia to streamline the system, to make sure that your healthcare dollar goes to your healthcare and not to a bunch of intermediaries who drive the cost of healthcare up and up and up. Also, I think we need to look at innovative programs that we see going on now. Newport News Shipbuilding has basically put their own clinic into place and just has an insurance policy for the very, very expensive things. That's an opportunity. It's worked very, very well. Save money, better health care. We can expand that and make that available to small businesses, make that available to individuals and communities. Have that same kind of concept where you cut out all the middlemen, you cut out all the overhead, and that health care dollar goes